For me, mental health and addiction are so tied together that it's really it's just a miracle when someone can find a solution. I resented my life, period. After losing that 10 years of sobriety, I resented my life and I turned completely off. New drug of choice, went from the cocaine and things from the mid-'80s and all of that trouble, then on to my 10 years in sobriety from 98 to 2008, the chemicals or the alcohol or whatever it is that we use to deal with the symptoms. But I had at times been on medication because the symptoms were so intense, running the street and using. Of course, I would be very anxious, super depressed, very stressed. And so when I would show up to the emergency psych, it would be impossible to really, diagnose anything. But I guess there was always the question, am I bipolar? Or, that would be I think the go-to diagnosis that I was hearing quite a bit. I had in the past been on medication, a number of different medications for bipolar and depression and things like that. Once we put the drugs and alcohol away, the question is, what else do, what do I do? There's the SAMI thing, which is substance abuse mental illness, and I went through that program and was on some mild medications, your kind of go-to bipolar medication, which would have been the Zoloft or Prozac. When I think about mental health, like my personal awareness of that in the context of like addiction and the on and off, using, then not using, the symptoms that were there before I ever picked up, which were part of my story that maybe led up to me picking up to begin with. I would pick up chemicals to help me feel okay, and being around people and being willing to follow suggestions and work the steps and show up early and stay late and become of use, and find that through the amends process that I didn't no longer feel super anxious around people because I had made proper amends, and I felt like I could look the community in the eye against what I'm doing all the do's. And I'm not doing any of the don'ts. In other words, I'm sleeping good, I'm resting good, I'm taking my medication, whatever it is that I'm on. I'm doing a little writing so I can really know the truth in a few weeks or a few months, depending on what exactly it is that I'm looking at. What's making me tick, what's helping, what's not helping, what I may see some kind of a trend in. Okay, things have changed. What's changing? I have to put this stuff in black and white. The power of the pen and talking with people is where I start to really, I'm able to identify what's going on, because if I'm doing everything that I'm supposed to do and going to a meeting and I'm getting up and I'm doing a little meditation and I'm getting out of myself and I'm being honest, and showing up to the, life, just the basic principles. Show up early, stay a little late. We're not asking you to be a superhero or a robot, but if you can just change a couple little key things, you're going to start to get these results that you might not have ever really been aware of. I'm committed to my recovery, because to get that magic and to be sober and reunited with your family and to be that person that people are just blown away by. When I came to BrightView, I really came here because I didn't know what else to do. So they set up a plan for me. So okay, we have groups. Every single thing that I have today started from the conversation that I had in that office up front with Kelly, and with the little moments of clarity that I would pick up on in group. Like these things, these simplest things are real. They are They are the solution.